Let's get the latest figures in the country. We're joined now via Zoom by Professor Adrian Puren from the National Institute for Communicable Diseases. Thank you so much for your time, Prof. We do appreciate it. I think the big question is what is actually going on with COVID-19 in the country? If you look at what the World Health Organization is saying, they're saying don't neglect COVID-19. It's still a worrying picture. But what do we know about the current picture in South Africa?
Yeah, so in South Africa, I think that the picture is that we've reached, I suppose, hopefully the nadir of the previous wave. And we're certainly seeing fairly low numbers in terms of the testing numbers overall. The positivity rate overall is 5%. However, there's variation across provinces, but in the main, it's less than 5%. Again, when we look at the hospitalizations and deaths, these are certainly substantially lower than what we've previously experienced. So we have a very different picture. I think the global picture certainly, when you start accumulating the numbers, this obviously means that we should not be complacent overall. Again, when you return back to South Africa, even though we have these low numbers, again, when you look at our vaccine coverage, the vaccine coverage for adults above the age of 18 is about 46%. And when you look at the distribution based on age, it's really in the older age groups where you possibly above the age of 50 or thereabouts, where you start looking at vaccination rates of 63 or thereabouts. So I think it's still critical that we look at what we have available, because that means we have ongoing transmission, even though it's at lower numbers. But that means that there's still risk. And especially in the older age groups, where we do certainly see a high incidence of infections and deaths as well, and hospitalization. So I think it's very important that we do not become complacent, even at the workplace. I think, the legislation is there to ensure that we do the risk assessments and make sure that people at work are safe. And that includes vaccination as part of that particular program.
We'll get into vaccinations in a short while, and I think perhaps the question is around what the South African government is doing to get people to understand the importance of vaccines. But I want to speak about the last time the NICD posted the weekly COVID-19 report, which was, if I'm not mistaken, the 18th of August. That was 2 weeks ago, with South Africa no longer doing daily COVID-19 reporting. Do you not think this has kind of given people a wrong idea that the virus is gone and not really reminding them that we still have an infection rate, even though it's very low, as you mentioned?
Yes, I think it's becomes very difficult, I think, from the perspective of having those daily figures. I don't think that the daily figures are really giving us a truer picture. I think it's really that weekly 7-day moving average that I think gives us an overall perspective, at least from the sense of interventions. So I think a daily figure, which changes by a small percentage, is not really that informative. I think what is more informative is really to look at the trends. But as I said, even there, when we look at the declining numbers of tests that are being formed, the lower rates of positivity, I think based on that, I think you're not going to make major advances or major interventions. I think it's when you start looking at other signals, and the signals, for example, are our deaths and hospitalizations. And of course, we also have the presence of the wastewater surveillance. I think those are more key and fundamental for us to really keep track of in order to tell us whether or not the picture is changing. And linked to that, of course, are the circulating variants in circulation. So I think those are, more informative than just the daily numbers. But you're quite right. It's still important that those numbers are made available, that they are monitored, and that we act on them where appropriate.
Do you think there's a danger in people not getting tested for COVID-19 as much as before? Because as much as this virus has evolved and changed and is not as severe as anymore, people might have COVID-19 symptoms but say, I think I just have the normal flu, or it's season change and this is why I have a bit of a cough and a runny nose. Is there a risk in people not actually getting tested for COVID-19?
Yes, especially those individuals that are at high risk. But I think the overall, you're quite right. I think even before we've reached this particular point, I think that people had already become or had adapted to the fact that perhaps those particular signs and symptoms are as a consequence of COVID-19 or some other infectious disease. But it's really critical that they monitor themselves and that they if their condition worsens, that they do seek medical attention. However, I think even, again, just coming back to the workplace, again, it's really important that at workplace that there are the mechanisms for people to actually report, because, again, if you become ill, what are the rules and regulations around your being tested, going into isolation, and or if you've been in contact with people or in close contact, again, how do you monitor and inform people? So yes, it's important that we do not become complacent. Again, assessing risk, whether it be at workplace, at home, at school. We're coming up to spring fairly soon, so we're going to have larger events where people are going to be in close contact. So I think, again, it's important to encourage people to assess their risks. Risks may now be low, but certainly conditions may change, and therefore it's imperative that we encourage people to assess their risks, such as, for example, including wearing a mask, social distancing. Those are still part of our key tools in trying to manage this particular pandemic.
Prof, as much as people are advising and health experts are advising people to wear masks, I think people are far beyond wearing masks now. I think everybody had it very rough for almost 3 years. So as much as there's the encouragement to do so, it becomes very challenging to get people to wear masks. I just quickly, before we move into vaccines, want to ask you if you know about a percentage drop in the amount of testing that's been done with COVID-19. Do we have those statistics or not really?
Yes, no, we do have the statistics. So you can actually visit the website and you can actually see the trends have certainly declined quite dramatically. I think it's about 29,000, 26,000 tests per week overall in the country. And the positivity, as I said, is about 4% of that. So it has certainly declined when you compare that to a month or two ago when we reached peaks of 70,000 per day. So it's a very, very different set of trends in terms of testing overall in the country. So you're quite right. People are probably having symptoms which are likely to be COVID, but are not testing because they're relatively well. But again, I would like to urge people, again, if they are feeling unwell, are ready to seek attention and get tested. And again, in terms of work policies, I think that's also really critical as well in order to manage those particular scenarios. But yeah, the trends are down. And
certainly not put anybody at risk, because we don't know what the next person could have, their comorbidities. Absolutely. I want us to move into vaccines, because we do know that government not so long ago was encouraging people to go and get vaccinated, those who have not been vaccinated, and government has been at pains to get people to go and vaccinate, and they've really struggled with their vaccine campaign. How imperative is it for people to still go and get vaccinated? I saw a tweet, it wasn't somebody in South Africa, it was somebody in the US saying that she completely regrets getting vaccinated because there is no longer a pandemic and there is no longer COVID-19. But people forget how this vaccine saved lives. How important is it for people to still consider getting vaccinated?
Yes, so I know that in South Africa, there's this argument that, in fact, people have largely been exposed not just due to vaccines, and we've seen that the vaccine coverage is not great, and it's at 46%, but that there have been all these natural infections as well. But again, my sense is that you just do not just need, for example, a natural infection, because again, you think of waning immunity. You also think about vaccines and its immunity as well as certainly waning, certainly too. So I think it's really important to consider that not only should you be vaccinated, but you should also consider getting your boosters, especially in the high-risk groups. So certainly, we're not saying that vaccines will prevent infection. Certainly, you'll have a disease, but milder disease. But I think the key here is that you'll have protection against severe disease. So even though you will be infected despite being vaccinated, it's still important to encourage people to be vaccinated, especially in the high-risk groups above the age of 50 or thereabouts, and or the presence of comorbidities such as respiratory diseases, diabetes, hypertension. I think that it still remains critical. So I think we should not give up on trying to encourage people to be vaccinated, especially in those age groups. As I said, overall, the picture looks 46% overall. It's certainly higher in those older age groups, but I think we should certainly encourage people to be vaccinated. It's not a South African specific problem. I think overall, as you've just quoted that particular tweet about, it's over, it's done. It's not done. And in fact, I think very often I'm thinking again around self-testing in South Africa, for example. Are there opportunities for people to access self-testing in order for us to monitor if you have those signs and symptoms? Can you then test and see whether you're infected and monitor that so that you can come out of isolation, for example? So I think there are these combinations of things of providing self-testing that can certainly provide opportunities for testing, and even in the presence of a vaccine, and encourage people to actually vaccinate as well. I think it's very important.
Just lastly, Prof, do you think our government failed in getting people to understand the importance of being vaccinated, not just with COVID-19, but with other vaccines, and the importance of how these vaccines basically save lives?
I don't think it's a matter of failure necessarily. I think it's not unique to South Africa. Certainly, I think there are challenges, as you've seen with the social media, for example, coming into play in South Africa, for example. I think it's become very powerful. So I think that's one particular area, for example, that one needs to tackle. So I think there's a range of people who are either fearful of vaccines, but they may have grounded either ideological or religious reasons for not being vaccinated. And those become very difficult to tackle. And you've seen in South Africa as well, it's not specific, as you quite rightly point out, around the COVID-19 vaccines, but there's a range of vaccines where people do not vaccinate. And I think we've been very fortunate, in fact, that the measles outbreak, we've certainly had a small number of cases, but fortunately, introducing ring vaccination and so forth certainly stopped that, I think, as well. So I think that those efforts are really critical. And how do we tackle each particular component or range across the spectrum of vaccine hesitancy, or and how do we tackle that and ensure that we do get the range of vaccine coverage that will really give us the highest level of protection? I think really becomes critical, and it's not specific to COVID-19.
Okay, great. Thank you so much for your insights. We do appreciate it. That was Professor Adrian Puren from the NICD.